situation. But meanwhile, I do want to stay in New York. We're gonna stay a little New York center focused right now because, like I said earlier, it was not only Nurse Appreciation Day yesterday, but it is Nurse Appreciation Week. It goes through May 12th, and guys, nurses during the COVID-19 pandemic, personally, I believe had to have one of the toughest jobs, especially, we reported on the surge happening in New York. You saw record numbers of deaths, record numbers of cases. Well, right now, we are being joined by Miss Bridget Hayden. She is a nurse and veteran emergency department nurse at North Shore University Hospital in New York, and she is here with us today. Thank you so much for joining us, Bridget. How are you?
I'm good. How are you? Thank you for having me.
Oh, absolutely. Thank you for everything you have done. I need to start off by thanking you for really doing your job, but a job that has posed probably more challenges than you could possibly imagine. So my first question to you is, you were right there in the brink of a really, really big surge there in New York last year. We saw that there were hospitals that didn't even have room for any incoming patients. So can you kind of explain your experience once this pandemic started?
Yeah, it was definitely intense. I mean, we had patients coming in all the time. It was hard. We had to have them say goodbye to their family members. That was for me the hardest part, just because you didn't know when they would see them again. And we opened up a second emergency room, basically, where we did all testing down the block from us. And then everyone in the hospital was very sick. I'd walk past rooms and they would be on their bellies and just trying to stabilize everyone. I mean, thankfully, we work in an emergency room, so we know how to take care of very sick patients. It was just kind of every day was a really, really hard shift for everyone involved. But we were able to get them upstairs, and the upstairs. I mean, the hospital worked flawlessly between the ICUs and the medicine floors, and everywhere turned into telemetry, and everyone was just going throughout departments and really just being there for the patient, and just went right down to the root of medicine. So it was a good experience, but it was very hard. But we did a very good job with doing it, and our patients got better eventually.
Bridget, I was so curious at first because when COVID-19 I remember reporting the first case out of Washington State at the beginning of last year, and no one really knew what this disease was. So when you, as nurses, as medical professionals, you're with doctors, when you heard of COVID-19, what came to your mind about a new virus starting to sweep through America?
I mean, Ebola. I think everyone went straight to Ebola and was like, oh my God, are we going to be in these suits? Like, what is this? I'll never forget when they told us we had to wear masks. We were like, what? What do you mean wear masks all the time? And then we didn't think I kind of didn't think it would come to us. I was like, no, it's in Washington. Like, no, it's in China or whatever. And then it came to us. I mean, it came so quickly that we didn't really have time to be like, what's going on? We just kind of did it. And it definitely came. But it was all respiratory. We knew how to take care of respiratory patients. So it was just scary that it was spreading so quickly, and then schools were shutting down and it was spreading everywhere. And it was a lot, but yeah.
So Bridget, wait, that's not even the video that I wanted to play. Not yet. That was the Taylor Swift tweet, and we'll get to that in just a minute. But I do want to pull up this video. So you told me that you put together a link for the community to share words of encouragement, and it actually ended up going beyond the community, and it was recognized all over the country and internationally. So what can you tell us about this?
Yeah, so we got a delivery from the girls, these two girls. They gave us all their Girl Scout cookies, and they wrote like the sweetest note, and we kept getting all these food deliveries from the community, and they had the nicest letters in them. So I was like, wow, how can I put this all together and like give this to the staff to encourage each other and give us strength? So I put together a Google link where people just put in their messages, and they sent it out to their family and friends, put it on Facebook, whatever. And within like 5 days, we got 1,000 messages from people's family members all over they haven't seen. So went to like England, went to Hawaii, went all over. So, and then I printed them out and put them on boards in the hallways. So then we were walking to the lab, we'd like stop and read a few messages, and they were so nice. I mean, calling us heroes. This is a profession that my mom was a nurse, and I only ever thought about being a nurse. I never really thought I would become a hero, though. I know that what we do is heroic, but to be called a hero on a daily basis from people in the communities, it's a lot. So it was very nice to have all those messages and words of encouragement.
Yeah, and Bridget, I think personally for me, you guys were heroes because you were in a situation where I know it's got to be tough in a normal world when a patient was not doing too well and you were trying to keep their family updated, but at least their families were in the room. What was it like having to take care of COVID-19 patients that were maybe not doing so well and their families were not even allowed to see them?
Yeah, that was the hardest part, just because you wanted to be there, you wanted to hold their hand. And so we had FaceTimes. We were able to have iPads throughout the hospital, which was really good. And we just became used to calling them on the iPads. It was funny. I'd like write my notes, like, family updated on plan of care via phone. But we really did sit with them and we spent time with them and gave them the iPads. And then my friend collected little stuffed animals for them. And so we'd give them stuffed animals just to hold on to. So, but I definitely miss the families being there. I miss the patients' visitors, just because I feel like when you're sick, you should have your loved ones there. Granted, there's a reason why we couldn't, but they should be with them, you know. Just to hold their hand.
I'm gonna, obviously it was very, very tragic that we saw so many COVID-19 related deaths, but it was a miracle and it was something that should be celebrated when a COVID-19 patient got to go home. And I'm gonna play some video of you and your coworkers having a celebration. So when a COVID-19 patient got to go home, what did you guys do?
So they would ring a bell throughout the hospital when a patient was being discharged, and then they brought them out through the emergency room because we were considered all COVID, because they didn't want to do the main lobby with like labor and delivery and surgery patients and stuff. So they came out through the emergency room. And so we at first just had it on a piece of paper, like Happy Discharge Day. And then we got this big board and we wrote, and someone who has neat handwriting, not myself, Happy Discharge Day, love the ED. And then we lined up in the ambulance bay and clapped them out as they walked out. It was really nice because like we saw them in the beginning of the journey. Like there were a few nurses being like, that was my patient, like he's doing better. So that picture you see there is from the 1,000th discharge. And then just a few months ago, we had like a 103-year-old get discharged. So we did another clap out, a big clap out for that. But they don't walk through the ER anymore. But it was just a fun way to de-stress and be like, things are getting better. And, and then we'd hear the chime and I would tell the patients, I'd be like, this is a patient that's being discharged. Like we are on the path of recovery. It was
Bridget, I'm curious, how did this affect? We saw so many stories when we were in the brink of the pandemic, literally this time last year, because nurses were around COVID-19 patients. They were around the virus so much. We were reporting stories that they were not able to see their family for so long. Did this affect your personal life in any way?
Yeah, 100%. My best friend lives in London, so she was home during that time, and like I couldn't see her because her family owns a restaurant, and they were just trying to make their way in the restaurant, so I wasn't seeing her. My sister was 9 months pregnant at the time and had her baby in April, and I wasn't able to see her in her last month of pregnancy, and I wasn't able to hold Gavin until June. So that was very, very hard. I'm a big family person, big friend person. I like to spend time with people outside of work. So that was hard to not do. But we had each other. I mean, I'm so close with the people I work with. We had a group chat that we talked every day. We had Zoom happy hours. We had yoga classes on Zoom. So we really made do. Thank God for Zoom. Thank God for iPads. Thank God for FaceTime. Like...
I can absolutely say the same. Yeah, no, as soon as the pandemic started, we as reporters were instructed to start working from home, and Zoom We're talking through Zoom right now. I had never heard of Zoom before the pandemic, so it's great to hear that you were able to have people get in touch with, their families and get in touch with your own family. Now, I'm going to switch gears here because obviously we are recognizing you. The world should recognize nurses, but it's got to be amazing to be recognized by your favorite celebrity. I'm going to play this video here of Taylor Swift tweeting Bridget. Okay, so tell me about how you love her, and were you freaking out when you saw this? How did this happen?
Oh my God, I was freaking out. I'm a huge Taylor Swift fan since I was like 13. I've been to 43 concerts of hers. I've gone all over the country. I'm a huge, huge fan. So she was supposed to have a Lover concert last summer, and she had to postpone it, which now wound up being canceled. But when she postponed it, she played the songs that she played when she first put the music out. She had a performance that they had recorded. So I came home from work and I was watching the concert, and I just tweeted that I was like relaxing and unwinding and celebrating Lover, like at Taylor Swift, like, thank you, I love you. And then she tweeted me back that when Cornelia Street was playing, which is like my favorite song, and I freaked out. I absolutely freaked out. I still don't think that happened. But I got it blown up on like a poster board, and it was in the hallway of all the encouraging messages at work. So I was able to look at that. It was the craziest thing. Again, I don't think it still happened. I like look at that and I'm like, what?
No, that better be an 8x12 in the middle of your wall in the hospital.
Oh my God. Yeah.
That's amazing. Crazy. That's amazing. Well, I have to ask now, we're starting to see a light at the end of the tunnel, a lot of people getting vaccinated. What is your job like now?
So now we're, we still see COVID patients coming in, but we are able, thank God, they get tested outpatient. Like there's so much more resources to get tested. So they come in already knowing that they have it, so we can isolate them and take care of them appropriately. But all the other patients, it's nice. We're starting to give the vaccines out to patients. A lot of people did overtime throughout the winter, giving the vaccines out in the community and stuff. So now our role, I spoke to a patient yesterday who had their doubts about the vaccine, and I shared that I, as well, in the beginning was nervous, but I spoke with my doctors. We had a Zoom with all of the doctors that I work with, that I would trust my life. I trust my patient's life with them. I trust my family's life with them. And they shared their views on it. And I looked at the research and I made my own decision. So it was kind of nice to share that experience with the patient in hopes that they listen to my feedback. But we're just back to being the regular emergency room, sending patients to the OR and to the floors, the whole thing. So.
Awesome to hear. Well, my last question to you is, I can't imagine what the emotions you were going through at some points of just what is supposed to be your everyday normal job. What has this experience being a nurse in the middle of an unprecedented pandemic taught you?
That strength is real, and you can get through anything if you have the right people with you. And good vibes is what you need, and you need to pray that things will get better. But definitely strength and having the support of other people around you is huge. And when someone's breaking down, let them break down and give them a hug, even if you're in PPE. But definitely when you're feeling overwhelmed, let it out, because it gets overwhelming if you keep it in.
Well, we thank you so much for joining us here on NewsNOW from Fox to share your experience. Thank you. Is there anything else that our viewers should know before we send you off? Anything else you want to say to them?
That you guys are heroes too. Everyone has had their bad part of the pandemic. That you can't speak to anyone who said they didn't have a bad part. So just know that everything that you did by wearing masks, by staying inside, by not being able to do everything that you want to do to live your life, that you're also heroes. And I appreciate you. We appreciate you. Be nice to people, be understanding of people. That's about it. Be safe.
Well, Bridget, thank you so much. Again, Bridget Hayden, everybody, a veteran emergency department nurse at North Shore University Hospital in New York. We thank you for joining us. We thank you for doing what you do, and we hope you have a great weekend.
Thank you so much. Thank you for having me. Have a nice weekend.
You as well. All right, everybody.